So Gail Strake and Casey Gwynn were one of the two prosecutors from San Diego that founded the Strangulation Prevention Training Institute. So what happened is they had two very young women killed. I want to say it was in basically 2 weekends. Boom, and then boom. They got these cases, these young mothers in domestic violence situations. They were like 19, 20, young, leaving behind babies. And they said, whoa, one is a tragedy, two is a pattern, let's look and see if there's more pattern. So they started to actually look deeper and saw this huge pattern of correlation of strangulation with homicide. So there's also a correlation with about a really horrible domestic violence assault about a month prior to the homicide. So typically it's so bad that it means the police come out or they go to the hospital because it's that bad. About a month. And they said it's anywhere from between 75 to 90% of homicides had that assault prior. When we talk about strangulation, it used to be, it was strangulation, which meant they were dead, or attempted strangulation, meaning that they were trying to kill them, but they didn't. So that was an attempted strangulation. And they realized, whoa, that's absolutely wrong. Words are important. Words are very important. It's actually non-fatal and fatal. So they're not trying to kill you. They're not trying. They're trying to tell you that I can kill you. I have that control. I will kill you if you leave me. I will kill you unless you do what I say. So this is Gail. And prosecutors are very dramatic. That's what they do. They're up there, this is a killer. Gail Strake was also a defense attorney, so she's really dramatic. I love it because our names are so similar. But they're saying, I can kill you, and every time I don't kill you, I'm giving you your life. Aren't I great? So there's so many different ways that an abuser makes that power dynamic, but they put it in their head.
This chart shows data collected from Northern Navajo Medical Center Emergency Room. This data represents statistics on domestic violence and sexual assault that came into the ER from May 15th, 2020 to May 15th, 2021. There are some notable things about this data. Assault and battery and domestic violence compiling 73% of the injuries in the ER. Sexual assault is 15%. Domestic violence and sexual assault add up to 8%, and strangulation is at less than 1%. This is a clear representation on why your documentation of injuries is so important.
We have injuries to necks. You can have injuries to necks. This happens to be a ligature mark. Yes, this is a baby. But it's really important to know that it's not about the killing, it's about the controlling. And with the law, it's intent. If they're not intending to kill them, then, But it is absolutely, they're intending to control them. So what is our vocabulary? Choking. Yes, they choked me out. I had this lady at the hospital. She was a big, strong lady. And she had been shot, I think total was 7 times. 5 ringed her heart. Okay, it was a small firearm, small handgun, and boom, boom, boom. It did get her lungs. She had chest tube, but wow, it missed all the important structures, right? And it shattered her femur, so she had a big old wound back on her leg. So she'd been shot 7 times, 5 around her heart, and this was IPV. So I'm in there doing my IPV exam, domestic violence, asking about a history. Did he ever choke you, strangle you, put hands on your neck? Oh, he tried to choke me once, but she totally discounted it. She tried to make out like she was very strong. I mean, at this point, her bravado was really trying to make up for her. She was embarrassed and ashamed that this guy almost killed her. It has a different feeling when you're actually talking to somebody who should actually be dead. The intent was death and not just harming. Sometimes, we have these terrible ways of saying something, like I'll call a bruise beautiful. It's a beautiful bruise. It's got great colors. Ooh. No, they're terrible. They're absolutely terrible, but we can still appreciate them for evidence, and we can appreciate their color. Yeah. So when I always say, okay, let's talk about that strangulation, and let's talk about what it means. So as soon as they discount it, as soon as they acknowledge it. So throttling, choking, choked me out. He's kinky. We'll talk about that. Okay, so what it really is, it's the impairment of the blood or the airway. Okay, people think about the airway. They don't think about the blood. They don't think about the carotids. What are our airway here, right? Carotids and jugulars. Those are the important vessels in there, plus the trachea, right? I got this. That's so nice. So we've got this airway tube, which is really important, but the most common question is, were you unable to breathe? Well, they were still able to breathe. Well, they were passing out, but they were still able to breathe. Interesting how that can happen. Because the neck is interesting. So I just say, please, did somebody put hands or something on their neck? Strangulation is dangerous. It's deadly. There are fewer, scarier things you can do to another person to deprive them of their ability to breathe. Sometimes the blood flow is cut off so fast that they don't actually get scared that much. It's so fast. Do you know how long it takes to pass out? 5 or 6 seconds. Ooh. Did you look at the... Yes, aren't you good? 6.7 seconds. So there was a study done, carotid occlusion in 1945. They could never replicate this. They used basically a blood pressure cuff on somebody's neck, and they occluded their carotid and femoral and timed how fast they passed out. And they did this to prisoners and people who were mentally ill. They were using it as kind of like insulin shock therapy. They were like, oh, maybe this will help them reset, right? Like, yeah, no. So, but 6.7 seconds. And they will show some tonic-clonic movements as well. And if you, I'll go into more of it, but yes. But it is one of the best predictors of future homicide. It's hard to prove in court. Everything related to gendered violence is hard to prove in court. What do they like in court? They like video, they like pictures, they like evidence, hard evidence. They do not like domestic violence or sexual assault cases in court. They don't. All of these are hard to prove. We had a police officer take a report on I did a DV case the other day, last week. Terrible. The guy's really scary. He's MMA fighter, bodybuilder, and he takes steroids, anabolic steroids. Has any of you dealt with somebody who's ever taken steroids? They're unpredictable. Rages. So you've got that unpredictability, desire for control, plus this inability to control themselves. So 4 hours I spent with that patient. And then the police officer wasn't going to charge the strangulation. And the advocate was there and said, you didn't mention the strangulation. He said, oh, it's so hard to prove in court. Well, that's not your job. Like, we're taking an assessment. I'm not going to say you can prove it. It's just important. And you need to address it and allow them to take them forward with it. It's a felony offense. You don't just make that decision. She basically, you're just a cop, Tim. I'm like, I'm just a nurse, right? I'm proud to be a nurse. I don't want to be a doctor, but she basically, you're just a cop. I love it. But it's important. We can't go by the lack of ability. That was one of the reasons that they didn't make strangulation a felony prior. It's because how hard it is to prove in court. Doesn't matter. We still got to take it forward. So even if it's difficult to prove in court, I can go and testify. You guys could go and testify. You've got specialized knowledge. What does it take to be an expert? More knowledge than the average bearer. Okay. It'll be difficult to discuss in court, but it's important that people understand how serious it is. Some have serious internal injuries. So it is true that they can have serious internal injuries, like a carotid dissection or swelling. Sometimes there's a tear to the trachea that can cause swelling and cause harm over the next 2 days. That's rare, but lethal, okay? They can go undetected. And how a person feels when they're having something applied to their neck is that they feel like they're going to die almost all the time. This graphic says 70%, but really I think it's closer to 90. At least the people that we see. A lot of the patients who may have been strangled many times, they stop thinking that they're going to die because they're getting used to it. It's like having that gun held to the head this many times. You're just getting used to it. So it no longer has the threat that it used to. Now the problem with that is that strangulation is the upped threat. It is the higher level of force. And if there's not a lot of levels higher, homicide is coming. If they're losing control, they may kill. So it's blood flow or airflow or, okay, either. We know that 1 in 4 women, okay, will experience serious domestic violence, okay. Now, loss of consciousness can occur within 5 to 10 seconds, 6.7 seconds. Most of the time it's done by their hands. Okay, I think you have that graphic on the back of one of them. About a third report losing consciousness. So how do we lose consciousness? Airway, but the blood flow, boom, fast. People are shocked at how fast. You can YouTube it. I have a YouTube, but probably on my old slide. But with the airway, it takes longer, and they're more likely to fight a little more. But they don't have to lose consciousness in order to be strangled. A lot of them are strangled and sexually assaulted. Those are really violent. And the odds of homicide increase over 750%. They're saying higher levels. When they started doing these statistics, people weren't looking at strangulation or, like I said, non-fatal strangulation. They weren't tracking it. Now people are tracking it because we've got laws in all of the states almost. So now the statistics are coming back and they're coming better, and they're seeing a higher increase. The tie between strangulation and homicide is increasing.